There are now more than 1,600 patients with the coronavirus in hospitals here in Massachusetts, and the nurses caring for them are stressed and overwhelmed. And as WBZ's Beth Germano shows us, they're frustrated by how the virus is spreading.
A tidal wave, absolute tidal wave. It's a tsunami.
It's the most stressed Kathy Reardon has felt in her 32 years of nursing.
This virus is surging, and it's very deadly, and we see it every single day.
The second surge for these frontline nurses is here. And like Karen Richard, in the designated COVID unit at Health Alliance Hospital in Leominster, it's exhausting.
It's frustrating to see more and more cases, and we're kind of knocking ourselves out. We're shrink wrapped in plastic essentially from head to toe, and it's uncomfortable and it's sweaty, and the patients are scared.
They say patients tell them they traveled over Thanksgiving, had family gatherings, and now the numbers are climbing, with nearly 6,000 new cases in Massachusetts yesterday.
We're having to take more COVID patients than we did during the first surge of the virus, and it's incredibly difficult to try to care for all of these patients. Just like I said, again, between the medications and the assessments.
They now have a better understanding of the deadly virus, but Dr. Juan No, chief of emergency medicine at Brockton Hospital, says that adds to the stress.
Having gone through it once and seeing a lot of sick patients and the inability of their family to be with them, it was very hard. And now starting to see it happen again.
The nurses say they were preparing for this post-Thanksgiving surge and now feel more prepared to deal with it, but worry it will be a long haul with the Christmas holiday approaching.
It's very frustrating for us because we're trying to save people and take care of you, and people aren't listening to us.
And they say that message is simple: to follow the precautions, because the care they are giving is even more demanding. Beth Germano, WBZ News.